My name is Manira, and I am an extern at UOP Hearing and Balance Center. I'll be presenting with Dr. Stephanie Ravel, who is an audiologist at our Stockton clinic on tinnitus. Our presentation is called Tinnitus, What is that sound and what can we do about it? Please feel free to use the chat function if you have any comments or questions. We'll try to respond to all the comments as soon as we can, but if we don't get to your comment or question, we'll answer it towards the end of the presentation. There is also a live transcript function. If you guys just click at the bottom where it says live transcript, you'll get that closed captioning. Along with Dr. Ravel and I, we also work with Dr. Gale, who is the director at our Stockton clinic, and with Iris, who is our clinical service associate, and with Cherry, who is our administrative assistant. Again, Dr. Ravel and I are located in Stockton, but we also have another clinic located in San Francisco. The audiology program for UOP is located in San Francisco. We would like to acknowledge the staff at our San Francisco clinic. Some of you may have had the pleasure of working with them. And here's the rest of the staff members at the San Francisco clinic. So for today's presentation, we are going to start off with an introduction, then we'll go into the causes of tinnitus. After, we'll briefly discuss the auditory system and the anatomy involved. We'll also talk about management options, and lastly, we'll discuss resources available. I'm not sure how that line got there. In addition, we'll be answering these 5 commonly asked questions throughout the presentation. Number 1, what causes tinnitus? 2, should you see a hearing care professional? 3, should you have a hearing test? 4, are there treatments available for tinnitus? And 5, how can I sleep better with tinnitus? So what is tinnitus? Tinnitus is sound that is perceived without an external source. It is commonly known as ringing in the brain. It can be described as ringing, buzzing, humming, roaring, whooshing, hissing, crackling, pulsating, or a combination of sounds. Tinnitus can be intermittent or it can be constant. Tinnitus can last a few seconds or several hours, and it can occur a few times throughout the day. It can also be described as non-bothersome or bothersome. Tinnitus affects millions of people throughout the world, and in some cases, it can be challenging to cope with. However, it is possible to live a normal life even with tinnitus. There are 3 general characteristics of tinnitus. First, it is a perception of sound, so it must be audible to the individual. Second, tinnitus is something that is involuntary, so it cannot be produced intentionally. Third, it originates from inside the head. Although many patients state they hear their tinnitus in their ears, the source of tinnitus is actually the brain. There are also 2 types of tinnitus, subjective and objective. Subjective tinnitus is experienced only by the individual as the noise is not occurring in the environment. Subjective tinnitus is more common than objective tinnitus. It is due to a variety of either peripheral or central abnormalities, such as hearing loss or an acoustic neuroma. Objective tinnitus can be heard by both the individual and others. Objective tinnitus is caused by systematic irregularities, such as muscle spasms. This type of tinnitus should be medically evaluated. One thing we want to make clear about tinnitus is that you are not alone. Tinnitus is a common problem for millions of people, even in individuals with normal hearing. For example, in a study completed in 2016 called Prevalence, Severity, Exposures, and Treatment Patterns of Tinnitus in the United States, the researchers analyzed responses from the 2007 National Health Interview Series, where they asked, in the past 12 months, have you been bothered by ringing, roaring, or buzzing in your ears or head? The answer choices included options ranging from not a problem to small, moderate, big, or very big problem. What the researchers determined was that an estimate of 222 million individuals had experienced tinnitus in the past 12 months. The histogram on this slide shows the responses of the adults who were asked the question about their tinnitus in the past 12 months. So at the bottom of the histogram is age, and on the side right here is individual count. And what we can see is that during the 6th decade, the number of individuals with tinnitus is the greatest compared to all the other decades. And for most people, tinnitus is considered a small problem, which is shown in green on the histogram. The researchers also determined that tinnitus is more prevalent in males than females. So this slide shows that 10.5% of males compared to 8.8% of females experienced tinnitus within the past year. This is most likely due to noise exposure. One second. However, there is no significant difference between the severity between the two groups. So most individuals reported their tinnitus as a small problem or a moderate problem, and very few reported it as a big problem. The table also indicates that men are more likely than females to discuss their tinnitus with their physician, 52.8% of males versus 48% of females. So now we are going to discuss the causes of tinnitus. We divided the causes into two categories, common causes and other causes. The exact physiological causes of tinnitus are not known, but what we do know is that tinnitus is not a disease, but rather a symptom of another underlying condition. One of the most common causes of tinnitus is age-related hearing loss. Typically around the age of 60, hearing begins to worsen. The reason for this is because of inner ear cell damage in the hearing organ known as the cochlea. Does somebody have a question? I see a hand raised up. Okay, we'll get to your question at the end if you remember it. Another cause is exposure to loud noises. When we are exposed to loud noises such as chainsaws, concerts, firearms, noise-related hearing loss can occur, which can result in tinnitus. Earwax blockage is another cause. Too much earwax can cause an individual's hearing to be affected or irritation of the eardrum, which can lead to tinnitus. Changes in the bones in our ear can also lead to tinnitus. Our middle ear is composed of 3 important tiny bones called the malleus, incus, and stapes. When these bones stiffen, this can affect your hearing and can cause tinnitus. Various medications can also worsen your tinnitus. These medications include antibiotics, drugs used for cancer, diuretics, certain antidepressants, opioids, and aspirin taken in extremely high doses. Another cause of tinnitus is head and neck injuries. Head and neck injuries can cause tinnitus because damage to the head or neck can affect the inner ear, the hearing nerve, and the brain, and all 3 of those components are linked to hearing. An acoustic neuroma, which is a non-cancerous tumor, can also be a cause of tinnitus. The tumor develops on the branches of the 8th cranial nerve, which is called our vestibulocochlear nerve. This nerve runs from the brain to the inner ear and functions in both hearing and balance. Typically, tinnitus is a symptom in the ear with the tumor. Meniere's disease, which is a less frequently caused of tinnitus, can also play a role. Meniere's disease is an inner ear disorder that is a result of abnormal inner ear fluid pressure. Tinnitus is one of the several symptoms patients experience with Meniere's disease. Hearing loss, oral fullness in the ears, and episodes of vertigo are other symptoms of Meniere's disease. Tinnitus can also be a symptom of TMJ disorders. Your temporomandibular joint is a joint that connects your jawbone to your skull. Working with a dentist may help alleviate the tinnitus. Blood vessel disorders can result in tinnitus in rare cases. This type of tinnitus is called pulsatile tinnitus. Pulsatile tinnitus is defined as thumping or whooshing sound in one or both ears that seems to follow a steady beat. These are just a few causes of tinnitus. To evaluate and determine management options for tinnitus, various assessments may be completed, which includes 1, an audiological assessment. Because tinnitus is most commonly associated with hearing loss, it is important to have an audiological assessment evaluation. This assessment will determine if hearing loss is present and will provide important information that can be used for tinnitus-specific testing. Tinnitus-specific tests include testing to determine the loudness, the pitch, masking levels, and the level of disturbance of the tinnitus. These tests can provide beneficial information to determine management options that work best for a patient's specific needs. 2 is questionnaires. Questionnaires can be used to determine different aspects of tinnitus, such as severity, emotional and cognitive distress, intrusiveness, and how tinnitus affects your sleep. There are several questionnaires that can be used by a healthcare provider to identify difficulties you may be experiencing because of your tinnitus. A review of your medications with your primary care physician is another part of a tinnitus workup. As mentioned in the previous slide, we know that certain medications can worsen your tinnitus. So reviewing and making modifications to your medication list with your doctor is another aspect that should be taken into consideration. And last, visiting an ENT or an ear, nose, throat doctor or other specialized healthcare professionals, such as a psychologist, cardiologist, or dentist, are important because tinnitus can be caused by many health conditions. It can have an impact on your life. Seeking assistance through a healthcare professional can be beneficial in determining answers about your tinnitus and for your overall health.
Thank you, Manira. I think now might be a good time to answer a few of the questions in the chat box. One of the questions is, what about fevers or infections? So it depends on the type of infection. You know, there are certain types of infections that can actually attack the inner ear. And in those cases, that can lead to tinnitus, or even a middle ear infection, which is what is more common, may exacerbate the tinnitus while you have that infection, and it makes it more noticeable. But typically, once the infection resolves, the tinnitus will resolve as well. We will talk a little bit about the effects of noise exposure, but very loud noises or loud sustained noises can damage the auditory system. And so, yes, that can contribute to tinnitus as well. Large doses of ibuprofen can also cause tinnitus. Okay. So in order to understand tinnitus, it helps to have a basic understanding of the auditory system and how we hear. The peripheral auditory system is made up of the outer, middle, and inner ear. When sound reaches the outer ear, it is funneled through the ear canal to the eardrum. The eardrum vibrates just like a real drum and mechanically moves 3 small bones in the middle ear. The movement of the bones vibrates the fluid inside the inner ear, or the cochlea. The cochlea houses tiny cells called hair cells. These cells send electrical signals up the hearing nerves to your brain. This is an automatic process. There's no attention needed, and it happens at a subconscious level. So I mentioned those tiny cells called hair cells. Here are some pictures of those cells. The function of the hair cells in the inner ear is to convert sound vibrations into electrical signals that travel up the nerve to the brain. Damage to those hair cells can result in permanent hearing loss because after they're damaged, they do not have the ability to regenerate. Sometimes there can be damage to the hair cells before we even experience a noticeable hearing loss. And in some cases, tinnitus is an early sign that there has been damage to those cells. Factors that may damage hair cells include the normal aging process, exposure to brief or sustained loud noise, so like gunfire, or if you work in an environment with loud machinery, hereditary factors, or medications that are toxic to the cells. So on the left are pictures of normal hair cells. They're standing straight and tall, and they're forming distinct rows and bundles. And after there's been damage to the hair cells, they can bend or break, which is shown in the pictures on the right. So I see a great question. It says, does hearing loss equal tinnitus? Aren't they different? Can you have one and not the other? They are different, but tinnitus is a very common side effect of hearing loss. It is possible to have tinnitus without hearing loss with some of the other factors that we mentioned earlier. And sometimes we don't have a measurable hearing loss, but there has been damage to these cells where it may cause tinnitus, but it doesn't necessarily present as a hearing loss just yet. The central auditory system consists of the hearing nerve, the brainstem, and the auditory cortex. The electrical signal from the inner ear is conducted along the hearing nerves, the brainstem, and the midbrain to the auditory cortex. So while conscious processing of sound takes place at the cortical levels of the brain, some processing of sound actually occurs at a more subconscious level along the brainstem and the midbrain. Processing of sound can even occur while we're sleeping. So this is a video from the NIH that just shows the processes that I was talking about.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
Okay. So we talked about the auditory system from the outer ear all the way to the brain. But the next step in understanding tinnitus is understanding how our brain and body react to the sound input it receives. So the limbic system is a set of structures in the midbrain. The hypothalamus controls our autonomic nervous system, which is responsible for our fight or flight response. For example, if you were going to cross the street and you heard a loud honk of a horn, this would activate your fight or flight response. Your heart would be racing. You would probably also make a sudden movement to step back onto the curb. The amygdala evaluates stimuli in our environment and determines their importance and generates an emotional response. It could be positive or negative. So obviously, in the case of the car horn, the emotional response from the limbic system would be one of fear. However, there are other times when our brain may assign a positive emotional response to sound. For example, listening to a song we enjoyed from childhood may bring back a flood of positive emotions. So the autonomic nervous system is separated into two parts: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is responsible for our fight or flight response. When activated, it results in dilated pupils, increased heart rate, and faster breathing. This is a survival mechanism that is shared by both humans and animals. So if you imagine an animal being stalked by a predator, and then they suddenly hear soft footsteps in the grass behind them, this increased alertness and fear would lead to the appropriate response of either running away or fighting if necessary. The parasympathetic nervous system is responsible for a rest and digest state. So this is when our body is calm, our heart rate is lowered, breathing is relaxed, and we do not perceive immediate danger. Sometimes our fight or flight response goes into overdrive, even in cases when it isn't necessary. For example, imagine you are sitting in a quiet room and suddenly you hear an unfamiliar noise. You look around the room trying to figure out what it could be. Is it the washing machine? Is the air conditioner making a new sound? You ask your partner if they hear it and they do not. Suddenly you realize it's in your head. It's tinnitus. So you might have a lot of questions or fears running through your mind. Why did this start all of a sudden? Does it mean something is wrong? Should I be worried? This triggers the fight or flight sympathetic nervous system in response to this new experience. So what does it all mean? We went over a lot of anatomy, and I'm going to try to tie it all together. So keep in mind, there's still a lot that we don't know about tinnitus, but let's talk about what we think we know about the tinnitus pathway. So in the case of tinnitus that's caused by damage to those hair cells, let's just say there's damage to some of the hair cells in the inner ear, and this results in a mismatch in how sound is relayed up the nerve to the brainstem. In an effort to fill in the gaps, some low-level regions of the auditory system become hyperactive, resulting in a phantom sound called tinnitus. This could be a ringing, a buzzing, a hissing, or roaring. It's different for everyone. I'm going to try to briefly answer one of the questions that I saw in the chat here. So most commonly, we see tinnitus as a side effect of hearing loss, but yes, it can be caused by other factors. But it all kind of stems down into this mismatch that's going along in the auditory system, what the brain is expecting to receive and what the stimulation it's receiving are different, and it's creating this phantom sound. So the tinnitus is then evaluated by the autonomic nervous system, which decides whether it's important or not. If it's deemed unimportant, that's the end of the cycle. The brain will habituate to the sound and you'll be able to generally ignore it. And that's how we're able to tune out lots of sounds like traffic outside our bedroom window or the sound of a ticking clock. However, if the tinnitus is deemed important, then it may activate our fight or flight response, which results in physiological changes like increased heart rate, rapid breathing, stress. Then the limbic system will assign an emotional response to it. So having this emotional response, whether it's fear, annoyance, anger, it causes the brain to pay attention to the tinnitus. And that's the start of what we call the vicious cycle of tinnitus. So take note that this is all happening on a subcortical or subconscious level, which means it's all happening before our conscious mind even has time to apply any reasoning to the situation. So like I said, the vicious cycle of tinnitus starts at the subconscious level. Once our subconscious brain decides the tinnitus is important, it applies a negative emotional and physiological response to the sound. And this becomes a conditioned response that happens every time we hear the tinnitus. Our brain will notice it and focus on it more, in turn making the tinnitus worse. Treatment options, including sound therapy, work on breaking down these conditioned responses. The idea is to retrain the brain and the auditory system to eventually habituate to the tinnitus. So once habituated, you may be able to hear it if you listen for it, but generally it's not bothersome or impacting your life in any significant way. So Manira already talked about some of the initial workup that's recommended when evaluating tinnitus. And if you're unsure where to start, a great first step is to have your hearing tested. If your audiologist determines that you have a hearing loss and that you're a candidate for hearing aids, having a trial period with hearing aids is often recommended. In addition to helping you hear better, hearing aids may offer some relief from the tinnitus. By stimulating the auditory system, you're reintroducing the sounds that you were once missing. And for many people, this can make the tinnitus less noticeable or less bothersome. But in some cases, hearing aids may not provide enough relief, or maybe you're not a candidate for hearing aids. Maybe you don't have a hearing loss. In this case, you may be a good candidate for a treatment that involves sound enrichment with the use of sound generators. A common name for this type of treatment is called tinnitus retraining therapy, which is a combination of counseling, education, and sound therapy. So sound generators can take on many forms, but they're often most effective when worn on the ear because that means you can wear them all day long. They can even be added as a feature in a hearing aid. Sound generators often use a broadband sort of white noise signal, but can also include sounds like rain, a babbling brook, ocean waves, rainforest, chimes, crickets. So in this picture, imagine that the large spike on the left is your tinnitus, and the steady signal in the middle is sound from a sound generator. The third picture shows visually how sound from a sound generator would reduce the perception of the tinnitus. Even though the spike is still there, it is much smaller. So by weakening the signal of the tinnitus, the subconscious brain won't react so strongly to it. And by making the tinnitus more manageable, it can help break down the conditioned responses of the autonomic nervous system and the limbic system, ultimately ending the vicious cycle. But the idea is not to mask or block out the tinnitus completely. The idea is to lessen it to a degree where it is less noticeable and won't trigger such a strong conditioned response. So these are some of the most common and well-established treatments of tinnitus. Tinnitus retraining therapy, which I already mentioned, is a combination of counseling, education, and sound therapy, and it's typically administered by an audiologist. Progressive tinnitus management is a step-by-step program that was developed for the VA, and it's a standard treatment plan used with our veterans. In it, there are 5 different levels of treatment, from triage to audiologic evaluation, to group education, to tinnitus evaluation, and then to individualized management. Progressive tinnitus management, the Progressive Tinnitus Management Handbook is something that is freely available online, and it can be accessed using the link I included. Cognitive behavioral therapy works on addressing an individual's reactions to tinnitus. So it does that by challenging negative automatic reactions and restructuring thought patterns. Mindfulness is, quote, the meditative practice of being aware of sensations and allowing the present moment to unfold without judgment, end quote. So in this, with mindfulness, you're sometimes actually focusing on the tinnitus and paying attention to it and kind of sitting with it. This involves elements of yoga, relaxation, breathing exercises, and meditation. Cognitive behavioral therapies and mindfulness therapies can be offered by psychologists, therapists, or other professionals, including audiologists with special training in these areas. So there are also many things that you can do immediately and on your own. The vicious cycle of tinnitus is greatly exacerbated by stress. So taking steps to alleviate stress in your life can have a huge impact on the tinnitus and other aspects of life. So these techniques work on preventing or reversing the activation of the sympathetic nervous system when it is unneeded. Breathing exercises can include box breathing, which is breathing in through your nose for 4 seconds, holding for 4 seconds, and breathing out through your mouth or nose for 4 seconds or longer, and repeat until centered. For progressive muscle relaxation, sit or lie down and focus on the muscles in a certain area of your body. Squeeze and hold for 8 seconds, and then suddenly release while you exhale, noticing the release of tension. You can do this all the way from the face down to your toes. Guided imagery involves closing your eyes, relaxing, and imagining yourself in a calming place like the beach, feeling the warmth of the sun on your skin. And this can actually be accompanied by relaxing sounds such as ocean waves. So this works really well with the sound generators. There are apps and podcasts available online that offer some of these guided relaxation techniques. There's also research to show brief exposure to cold, like a splash of water on the face, can have a calming effect on the autonomic nervous system. Therapy, yoga, exercise, and self-care are all great ways to work on managing stress. So when I read about proper sleep hygiene, it all seems so obvious, but I'm also guilty of looking at my phone right before bed. It's important that we take time at the end of the day to wind down, and we may use our devices for sound enrichment and meditative purposes, but we want to avoid overstimulating content such as social media or videos right before bed. Use of a sound generator at night is also strongly recommended, as it carries over the positive effects of sound enrichment throughout the night. Making sure you're getting adequate daylight exposure and exercise are also important factors. And sometimes additional help or sleep assessment is warranted. Sound enrichment can help diminish the sound of the tinnitus, and that way it doesn't elicit such a strong negative emotional and physical response. So sound enrichment plays an integral role in retraining the auditory system to break down those conditioned responses. It's recommended to avoid complete silence, both at night and throughout the day. These sounds can include desktop or ear level sound generators, music, a fan, the TV. Overuse of hearing protection is not recommended, as this can result in reduced tolerance of loud sounds and can even make the tinnitus worse. So while tinnitus is typically not a major indicator of your overall health, it may be important to monitor certain aspects of your health in order to avoid making it worse. Smoking is a known risk factor for tinnitus. Alcohol and caffeine may or may not exacerbate it, and that depends on the person. Meniere's disease, which is a disorder that has the side effect of tinnitus, may require a low sodium diet. Diabetes is a risk factor for hearing loss and tinnitus and should be properly managed. And it is important to protect your hearing by wearing hearing protection when around loud, potentially damaging noises like firearms, loud concerts, or machinery. But like I said earlier, you want to avoid using hearing protection when it's not really needed, because this can actually heighten the sensitivity to loud sounds and can make the tinnitus worse. So I can't even begin to touch the tip of the iceberg in terms of all of the tinnitus treatment options or research studies that are available. And I'm sorry if I'm not able to get to everything, or I may not even know about everything that exists for tinnitus, but I will name a few. Biofeedback or neurofeedback is based on the idea that by measuring things like skin temperature, blood pressure, heart rate, or brain waves, we can learn to consciously control our body's physiological responses and our thoughts and emotions. Bimodal neuromodulation, this is a relatively new and very widely publicized area of research. It involves stimulating two neural pathways simultaneously. So, for example, it might combine sound and electrical somatosensory stimulation, like a vibration to the tongue. With this, the idea is that you're dampening the brain's response to tinnitus by eliciting a stronger response and heightened neuronal activity to other sounds. Vagus nerve stimulation is another area of research that's being evaluated, not only for tinnitus, but for other disorders, including anxiety and PTSD. So the vagus nerve, or the 10th cranial nerve, is the longest nerve in the body, and it controls our parasympathetic nervous system, so the rest and digest mode. Vagus nerve stimulation is thought to help strengthen our parasympathetic nervous system, allowing us to go into a rest and digest state more easily. Transcranial magnetic stimulation uses magnetic fields to stimulate nerve cells in the region of the brain involved in mood control and depression. It's thought to activate regions of the brain that have decreased activity in depression. There's currently a study going on at UCSF which involves this technique. So if you're interested in being involved in tinnitus research, you can search for research studies that are currently recruiting on clinicaltrials.gov. You can also ask your audiologists at UOP if they are currently recruiting for any studies. At this point, if Dr. Hu or Dr. Henderson Sabas, if either of you want to talk about research, you're welcome to chime in.
Hi, my name is Dr. Hu, Joe Hu. I don't know if I gave a talk last time, and I don't know if anyone remember my face. At UOP, we for both San Francisco and Sacramento sites, we have research going on. A lot of them involve basic research, not necessarily patients. Some involve normal hearing, younger adults or older adults. Some involve patients. Tinnitus research. One of our colleagues, Dr. Henderson Sabes, she conducts a collaborative research between us and UCSF on tinnitus patients. So we are actively recruiting people. A lot of you may have signed a release or research agreement to be contacted with about research projects. So we'll look through our subjects, patients list, and we'll reach out to you, or sometimes we'll send out an email blast. Hey, we need this particular set of patients, this particular set of participants. If you guys ever receive emails like that or email or anything like that, just if you're interested in research, participating in research, feel free to reply. And oftentimes these things either have some gift cards related just for your time. But mostly just to advance the research and to help more people with or without hearing loss. Okay, thank you.
Thank you.
And I'm Dr. Henderson Sabas, and I spend a good portion of my time researching tinnitus and hearing loss. And I'll add to Dr. Hu's comment that you are, being a part of the scientific community and moving our understanding forward. But I think sometimes you also get a benefit of having one-on-one time with experts like Dr. Hu, Dr. Ravel, but lots of different folks who are thinking very carefully about these problems. And so it does give an opportunity to have your questions answered, and also some FaceTime with people who think about whatever the issue, whether it's a balance problem or tinnitus problem or hearing loss problem. So we strongly encourage you, talk to your audiologist, reach out. You can see that NIH usually has clinical trial websites updated. You can learn more. And if you're curious, you can always reach out to us here at the University of Pacific.
Thank you so much.
Thank you guys for sharing that. So now we're going to talk about tinnitus resources. One resource that is available is the ATA, or the American Tinnitus Association. The ATA is a nonprofit organization with goals of promoting education, relief, and cures for tinnitus patients. The ATA also funds research for tinnitus. Over the past 35 years, they have funded over $6 million towards finding a cure for tinnitus. If you decide to become an ATA member, there's also useful information on their website, such as a series of podcasts called Conversations in Tinnitus and helpful tips on managing your tinnitus. You can also find inspiring stories about individuals with severe tinnitus and how they were able to control their tinnitus. There's also support networks in which you can call or email tinnitus patients. For general guidance and finding a provider that works with tinnitus patients, the ATA is one helpful resource available. There are also multiple apps that can be used to help manage your tinnitus. This slide shows some of those apps. Most manufacturers have a tinnitus sound app or tinnitus programs. For example, there's the Widex Zen app, there's a Starkey Relax app, and there's the Resound Relief app. There's also apps such as White Noise Light, which is the pink one in the upper right-hand corner, and the Relax Meditation app, which help generate sounds over a wide range of frequencies to help you sleep better. By simply typing the word tinnitus into either your App Store or your Play Store, you can see all the various apps available for tinnitus. So hopefully by now we have answered these frequently asked questions, but just as a recap, what causes tinnitus? The answer to that question is Common causes include age-related hearing loss, exposure to loud noises, excessive earwax. Other causes may include medications, head and neck trauma, and blood vessel disorders. 2, should you see a hearing care professional? The answer to that is yes. Tinnitus should be thought of a symptom of an issue. If you are experiencing tinnitus for the first time, we highly recommend either seeing your doctor or an audiologist. You may never know that tinnitus may be a result of an underlying problem that can be resolved by treating that initiating cause. 3, should you have a hearing test? The answer to that is yes. It's not uncommon to suffer mild hearing loss in addition to tinnitus. Without the distraction of external sounds to the ear, the tinnitus may be more intrusive and amplified. Diagnosing the hearing loss and wearing a hearing device can greatly reduce how aware you are of the tinnitus and improve your quality of life. 4, are there treatments available for tinnitus? The answer to that is, although there is no cure for tinnitus at the moment, there are several ways to manage the tinnitus. As Dr. Ravel mentioned, tinnitus retraining therapy, which uses a combination of sound therapy and counseling, is one effective way to manage tinnitus. Also, reducing stress, maintaining a healthy lifestyle, including getting a good night's rest, are all important in managing your tinnitus. And for question 5, how can I sleep better with tinnitus? The answer to that is tinnitus is most often noticeable in quiet environments, such as at night. As a result, this can make it difficult to sleep. Using sound generators or apps to provide ambient noise are helpful ways to distract you from your tinnitus. Again, if you just go into your app store or on your phone, you'll find a variety of apps that can help you manage your tinnitus. If you are an individual who has tinnitus or hearing loss and would like a hearing evaluation completed, please feel free to contact our offices in Stockton or San Francisco. And if you are a hearing aid candidate, you will receive a complimentary hearing aid consultation and a 45-day trial period to test out hearing aids. Okay, at this moment, we'll take any questions you guys have.
All right, so I'm gonna moderate the questions here. There are a lot of questions in the chat box. A lot of them, I think, have been addressed by Dr. Ravel and Manera. But can you just go over what may be the factors that make the tinnitus worse sometimes? So Sandra said she has tinnitus, usually it's mild and she can ignore it, but sometimes it gets very annoying. What make it worse?
Right, so there are several factors that can make it worse. For example, stress, a lack of sleep, medications, if you're taking any medications. Those are all things that can contribute to your tinnitus, especially if you're in a quiet environment. So, just providing external sounds to the ears and taking your mind off the tinnitus are going to be helpful.
Yeah, that's right. And sometimes we aren't always able to pinpoint what made it worse that particular time. But having the tools to help cope with it in that moment is what's most important.
All right, thank you. This question is from Adrian, and she says, do you recommend any over-the-counter pills or medicines that you find on the internet or over-the-counter?
As an audiology resident, I wouldn't say that, because as of right now, there is no FDA approved drug or cure for tinnitus. So, management options are the best way to go. So I don't think, over-the-counter drugs are going to be a solution yet for tinnitus unless if they're FDA approved.
There's a lot of research going into that area. And if they did find something that was really safe, reliable, and effective, I'm sure that it would be very successful. There are, a lot of herbal remedies that are marketed for tinnitus, and what you have to be careful there is that they're not regulated by the FDA. And sometimes those herbal remedies are a combination of lots of different things in one pill. And so you should be careful in knowing what it is that you're taking. Yeah.
All right, so just transition into that to a different question. What are your thoughts about traditional Asian approach like acupuncture as a treatment of tinnitus?
So acupuncture, there was a systematic review on acupuncture, and it showed mixed results. And I think historically it has shown mixed results. In the study that I'm referencing, the unblinded studies showed some positive results, but when blinded, the results didn't show any efficacy. That being said, acupuncture is working on calming the body, and it can target that parasympathetic nervous system. So if it's working for you, I wouldn't tell you to stop. Everybody's different, and I don't think it should be entirely ruled out as a possibility.
Great, thank you. All right, what is considered overuse of hearing protection?
So overuse of hearing protection would be using earplugs when you don't really need it. So an example of that would be, you're at home and maybe there are loud people talking, but it's not necessarily going to damage your hearing. Those are normal sounds that we're exposed to on a regular basis. And we're all exposed to some amount of loud sounds throughout the day, and that's okay. When loud sounds can become really harmful is when we're exposed to them for extended durations, or if it's a really extremely loud sound like a gunshot that's quite brief, those can be damaging. What gets tricky is some people, they crave that silence and they think wearing hearing protection will give them that silence. And what it does is it heightens the sensitivity of the auditory system so that the auditory system actually overreacts to certain sounds. And it can make you more sensitive to loud sounds, meaning those sounds will be more uncomfortable to you. And it can also, for some people, make the tinnitus worse. So even it's counterintuitive. You want to protect your hearing when it's really necessary, but you don't want to use it if it's not really a sound that would damage your hearing.
Very good, perfect. This question is about hearing protection as well. So is it safe to use noise canceling headphones to watch TV or listening to music?
Yeah, generally it's safe. You do want to be careful. I think where it gets a little bit risky is when there's a lot of background noise outside and people are turning up the level of their headphones to drown out the background noise. And so in that case, having noise canceling headphones actually helps because you'd be less likely to do that. Again, duration is a big factor. Everybody's different. I'm not going to be able to tell you exactly how loud you're listening to it, but you want to be mindful of that. You don't want to be doing it all day. Just being careful to listen to it at a low but audible volume and maybe take breaks and not listen to it for extended periods of time.
Thank you. All right. Does Medicare or insurance cover tinnitus therapies?
So Medicare will cover the evaluation for tinnitus. As far as the therapies go, typically no. And this is all going to depend on where you go and who you're seeing. If you're having cognitive behavioral therapy, I'm actually not sure. If you're seeing a psychologist, I'm not sure what is covered by Medicare and what's not.
All right. And there are a lot of questions about medications that may affect tinnitus. Do we have do you know the access to a list of medications that may affect tinnitus?
Yeah, the American Tinnitus Association has a nice list. You can always talk to your doctor. We know the common ones, are cancer medications, certain antibiotics.
Certain antidepressants, aspirin taken in extremely high doses.
Yeah, but ultimately it's best to talk to your doctor about it. And if you're taking a certain medication, it's for a reason. And so it's not something that you would want to stop without or change without consulting your doctor. It's important that you make sure you're addressing whatever that medical concern was first, and finding something that will work for you.
All right. So we have mentioned a little bit about psychological effects of tinnitus, but can you just clarify it a little bit more? Because that seems to make the tinnitus a lot worse.
Yeah, so this is actually the most important part. So a lot of people get kind of stuck on what's causing their tinnitus. And sometimes we aren't going to know, but the psychological reaction to the tinnitus and what's happening in the lower levels of the brain, that's the most critical piece, because that's how our body is going to react to the tinnitus. And so with a lot of these tinnitus management programs, what we're trying to do is break down these negative conditioned responses, so that the fight or flight mode doesn't kick in every time you're hearing that. And like I said, with sound therapy, that's what I'm most familiar with. What you're doing is you're making the level of the tinnitus more manageable. And so you hear it, but it's at a much more manageable level, which means your fight or flight response would be less likely to kick in. You may not have such a negative emotional response to it. And you're kind of retraining your brain to be able to handle it and ignore it and not focus so much time and attention on it. The more your brain attends to it, the worse it gets. And so we're trying to give you tools to use to draw your attention away from it and be able to manage it and cope with it in those times where it does flare up. For most people with something like tinnitus retraining therapy or a lot of the different treatment options that are out there, it's a gradual process. It's something that, you would see improvements over a span of 6 to 8 months. And then even then, after that, most people are able to get to a point where it's not really playing a significant role in their lives anymore, but they might have a flare up every now and then, but at least they have the tools to handle a flare up at that point.
All right. So that kind of answers the other questions about, someone is confused about if the tinnitus is a brain problem, why are the causes like hearing loss and infections and all that?
Yeah, I focused a lot on hearing loss because that is the most common cause of tinnitus, but of course we know that other things can cause it as well. And it's basically what we know about tinnitus, and there's still a lot we don't know, is that there's a mismatch happening somewhere along the auditory system. Maybe that was caused by noise exposure. Maybe it was caused by, an injury, or maybe we don't really know the cause. But yeah, ultimately determining the cause isn't always necessary and it's not always possible, but figuring out how to manage it is what's most important.
Okay, great. And then this is the last question. So did I understand that there are hearing aids which can provide white noise or masker, or are hearing aids just simply recommended to play music or, using the online apps? So what are the hearing aids useful for in terms of tinnitus treatment?
Both. So yeah, a lot of hearing aids nowadays do have the capability to activate a tinnitus feature that is built into the hearing aid. And so that may be just a simple sound generator, kind of like they have different kinds of noise, but I'll call it a white noise. And for a lot of people, that's very helpful. And that may be all they really need. But hearing devices, the fact that they're compatible with phones now and they have those Bluetooth capabilities, it also makes them really effective for using other apps. And I think Manira listed some of those, but there are loads of options available. Yeah, they're on here on this slide. And so those can also be streamed through hearing aids or even other types of headphones. If you don't have hearing aids available, I've heard of people doing that through their AirPods. There are pros and cons to that. And of course, the battery life is not going to last as long on an AirPod. And if you need hearing aids for hearing loss, then of course it's important to have the hearing aid. But yes, they can do a lot.
All right. And can you talk a little bit about how just wearing hearing aids without using the sound generator can help with the tinnitus?
Yeah, so for people who have hearing loss that would benefit from hearing aids and also have tinnitus, a lot of times just by wearing hearing aids alone, that's all you need. And the reason for that is because you're reintroducing those sounds that your auditory system was deprived of. And so it lessens that mismatch that I was talking about. It's stimulating your auditory system. So your brain is no longer having to fill in the gaps. It's not generating that phantom sound anymore. So lots of people do find relief just by wearing their hearing aids, and they may not need anything else. They might not need a sound generator or anything else built into the hearing aid.
Thank you. We have a couple more questions. What are preventative steps to take or use to prevent tinnitus from happening?
Protecting your hearing, I would say would be number one. And then also just, I think in general, for our general health, having good strategies for managing our stress and dealing with hard times. That's important because oftentimes tinnitus is most exacerbated when we are experiencing stress.
I think it's also important to note that tinnitus is something involuntary, so it's not something that we can create.
Great. Okay, and then last question. Are there any warning signs of a possible onset? So do we know when the tinnitus might be happening, might be occurring?
You know, I think sometimes there are warning signs. The most obvious ones are when you've experienced some loud noise exposure. I don't know if you've experienced this, but I certainly have. When you go to a loud concert and you leave and you have this sort of muffled feeling and you might hear a subtle ringing, that might be an indication that there was some damage to those hair cells. But for a lot of people with tinnitus, it comes on suddenly and unexpected. There may not be a rhyme or reason. And for the vast majority, it'll go away, but it becomes problematic when it doesn't go away and when it becomes bothersome.
I also saw in the chat that somebody commented that their tinnitus caused hearing loss. We just want to make it clear that tinnitus is a symptom of hearing loss. It's not an actual disease, if you want to put it as a disease or condition, but it's more of a symptom of an underlying cause. So even if you have a slight hearing loss, that can result in tinnitus because the neural networks of your brain are changing with the slightest hearing loss. So that can cause that perceived sound of tinnitus.
Yeah.
This is a pretty interesting question. Is there any known relationship between the use of THC and tinnitus?
I think this is a popular topic right now, and I don't want to give any false information because I don't really know what the status is of that. I've actually seen talk about THC being researched as you know, whether it's helpful or not, but I haven't seen anything conclusive, and I haven't seen anything that says THC would cause tinnitus either.
All right, okay. And this is going to be the last questions before I let everyone go, sorry. Do we know of any psychologists? Do we work with any psychologists that help tinnitus patients?
I did reference one. Her name is Dr. Jennifer Gans, and she has a mindfulness-based tinnitus treatment program. It's actually an 8-week program that you can do yourself online, but I know she also sees patients one-on-one, and she's very educated in the world of tinnitus.
And I put her link there in the chat box. Right, very good. I think we're all good with the questions. Well, thank you very much, Dr. Raval and Dr. Awa, Manira. This is a great presentation, and I hope everyone enjoy it. And again, we are going to put the recording up on our website in a couple of days, hopefully. But
Thank you
very
so
much.
much for attending. I'm so honored to be able to talk in front of all of you, and I really appreciate your questions.